5:39 on 550 and 107.1 KTSA. It's time to ask your questions about coronavirus, prevention, best practices. Why are we hearing this? What do you think about that? With a doctor. We get you covered every day on this show with different outstanding doctors who will take your calls and questions. And today we welcome to the show Dr. Mark Haverkorn. You've heard me talk about him. He's a board-certified oral surgeon, dentist, and medical doctor with River City Oral Surgery. And I asked him a few days ago, I said, would you be willing to come on and do this? And Dr. Haverkorn, you were so enthusiastic. It kind of got me excited about this, and so thank you for agreeing to come on. I know it's a busy time, but thank you.
Oh, no, I appreciate it, Jack. Thanks so much for the invitation. Last week I heard some of your interviews with some of those great doctors, and I thought, well, I'm not going to have much to say, but things are constantly changing, so there's plenty to talk about, I think.
I'd like to ask your opinion more, maybe in not just strictly as a doctor, but as a healthcare professional and somebody that follows the news. We're hearing a lot about what's happening all around the world with coronavirus. America is now one of the hardest hit countries in the world in terms of number of cases, and yet we look at South Korea, a nation with roughly the population of California, and they have something like 111 deaths, relatively small number of cases. Here you have the governor of California predicting that 25 million people in his state will get coronavirus. What are they doing in South Korea that we're not doing here, or what is it that makes some of our governors seem so much more pessimistic than others about how this is going to hit us?
Well, let's take the first part. What are they doing that we're not doing here? And as far as I can tell, everything I read about it is just testing, that they do more testing, separate the people that they know are sick or not sick but carriers. And, of course, we talk a lot about needing to up the testing game here in America. We've seen that possibly some new tests will be coming out, soon. So I think that's probably the biggest difference in what they're doing there from what I've read. I don't think they're being as strict as China was with the lockdown. I think they're just trying to isolate people quicker. As far as our governors here, I don't know why everyone, it's just a personality thing, I guess, Jack, and a worldview. When I talk to other doctors, I get the same thing. I get everything that you and your friends talk about from, we've got to shut everything down for a year, do everything that it takes, to people saying, this is no big deal. And that's in the medical community. So I think some of it's the worldview. Right.
It's what you're looking at and how you come to the question in the first place with what pre-existing ideas. I've had a lot of people ask me, and I wanted to ask you, especially as we anticipate this shelter-in-place order for San Antonio and Bexar County, would there be some merit in, instead of issuing orders or policies for everyone, would there be some merit in isolating the people who have it and the most vulnerable people who don't, but we don't want them to get it, and thereby freeing up everybody else to start resuming work or resuming other activities? Can you do that or not?
Well, so the answer is yes, you can do that, sort of, because of that latent phase where patients are infected and don't know they're infected. That's what's going to get you in that scenario. Of course, there would be some economic benefits to that, but how you handle those people in the middle is tough. But I think that's a question that our public, leaders are going to have to grapple with. It sounded like in President Trump's news conference, he was even talking about that kind of.
Right. He sounds like he's pivoting a little bit toward, making a decision at the end of these so-called 15 days. Let's get to a question for Dr. Haverkorn at 210-599-5555. Tom is on line number 1 on KTSA. Hi, Tom.
Hey, Jack. Listen, Tom, I had a question. You read so many different things about how this virus is transmitted, And so is it transmitted through the air, or do you have to literally have somebody's saliva on you to get it or ingest it? And because they say it's super contagious. So how is it really transmitted?
Okay. Well, one study out of China that I've looked at, just as a baseline for this question, says that we can find it obviously in the saliva, in the bronchial secretions, in the mucus. In 1% of patients, we can find it in the blood, and in about 30% of patients, we can find it in the feces. So if it's in any of that stuff, and you get that probably in your mouth and your nose, maybe your eyes, then you can catch the virus. The major way that it's spread just out in public is if somebody coughs, or, when you're talking and a little bit of spit flies out or something. If a droplet, of any size hits you, it gets into your mouth, into your nose, into your eyes. If somebody wipes their nose, and then touches something at the store, and you touch it while it's still wet and viable, and you get it, then, that's kind of how it's spread. Now, I have seen a lot of guys who are smarter than me saying that we shouldn't discount the airborne method, that it's possible that there's some airborne part to it, or at least we're not sure enough to say absolutely not. And that's where the 6-foot thing helps. In addition to if somebody does sneeze or cough, you're 6 feet away, so hopefully it hits your waist and not your face.
So if you shake someone's hand and it happens to be the virus happens to be on their hand, how long does it survive outside that host body?
Well, it's not specific to that person, so it can survive, on the hand. It really depends on what you're looking at. I don't know, and I could be wrong, but I don't know that there is an absolute answer on that, on the human hand. I know on a surface like a countertop in my office, that some people are saying it could be 2 days if you're not, sterilize or cleaning it somehow. On your hand, probably not quite so long, probably more like hours, but that's why we're talking about washing your hands and not touching your face.
Yeah. Tom, good questions, and Doc, thanks for those. We'll get to more of these with Dr. Mark Haverkorn coming up.
News Talk 550 KTSA and FM 1071.
KTSA News Time is 5:53. We are awaiting a news conference where we will hear about a possible shelter-in-place order for the city of San Antonio and or Bexar County. We'll bring you those announcements as they happen here on KTSA. And in the meantime, we're going to spend as much time as we can and get as many questions answered as we can with Dr. Mark Haverkorn joining us on the KTSA Connecticut Quality Water Softeners Newsmaker line. He is not only a medical doctor, but also a board-certified oral surgeon and dentist, and seeing people on an emergency basis so that if they have dental emergencies, they're not going to the ER. And the next question for you, Doctor, is from George on KTSA. George on line 2. Hi, George.
George. Oh, did y'all see that interview with journalist Tucker Carlson about quinine? He interviewed a doctor that said it's effective as a preventative and even possibly a cure.
I did not see that specific interview. I kind of wondered if that would come up because quinine is an older way of dealing with malaria, trying to prevent malaria. And obviously there's been a lot in the news about the newer anti-malarial drugs or Plaquenil. It's actually an anti-malarial drug that we now use for other things. That's that hydroxychloroquine that everyone's talking about. But I didn't see that specific interview. And I honestly didn't read a whole lot about quinine because in the research I'm looking at, it's not being talked about.
Would you recommend it for at-risk patients to try it? It wouldn't hurt anything. Most military people have taken it with no problems.
I'm not. To be honest, are they still? I don't know if you can get that over the counter. I'm not sure if anybody's going to prescribe it to you. I'll have to look. At one point, that was in tonic water. That's why gin and tonic got so popular in Africa, but I'm not sure if it still is.
Could that possibly be why in India there's fewer cases, relatively fewer cases?
There's some thought about that if you've got some sort of resistance to malaria, that perhaps you'll have some resistance to the virus, because if anti-malarial drugs are working, then maybe there's a link there. It's all still being worked out right now, honestly. and I can't say for sure.
George, thanks for the question. Appreciate that. Appreciate having you. 210-599-5555. You can also email me a question at jack@ktsa.com. And Dennis wants to know, what does herd immunity mean?
Sure, good question. That works in any area where we can vaccinate people. The idea being that if enough people are vaccinated and resistant to an organism, then that organism can't move through the population easily. It's going to hit too many dead ends. So that if you happen to be somebody for one of a few reasons that can't be vaccinated, if enough people around you are vaccinated, there's not going to be a carrier to bring that to you, if that makes sense. So,
are you hearing from people, or are you hearing questions? We're hearing a lot of questions, Dr. Haverkorn, about what are the best preventative options in one's diet, and I think they mean both in terms of fruits and vegetables, but also even supplements. Have you heard anything that you would encourage people to incorporate?
Well, I have seen a lot of chatter about that. I take a daily multivitamin. I'll be honest, I take that. I have seen some discussion about, zinc being helpful. I've seen discussion about vitamin C being helpful. If your body has enough vitamin C and you take more, most of it's just going to exit in your urine, in all honesty. But it also is not really going to hurt you unless you're taking so much that you give yourself a kidney stone or something. But so taking a supplement of vitamin C or taking a supplement of zinc might be okay if you want to do something. I mean, people are talking about links there.
You just put your finger on it. I think people want to feel like they're doing something, right, and they're seizing on whatever it is, but probably just in general, good health, healthy diet, plenty of sleep are all things that will put you in the best shape you can be in for this, right?
And then just do everything that we're telling you to do. Wash your hands. Try not to touch your face. I mean, I know that's hard. And do the distancing thing. I was at Walmart this weekend and I couldn't keep people off of me, and I'm sure we've all kind of run into that, So just do those things. I also, hey, if you're going into Walmart, don't bring your whole family. Send in one in your household. I think maybe some of the stores are doing that, but let's do that. If you got elderly parents, stay away from them. I mean, it'd be great if there was a magic supplement that would fix this, but there are some practical but somewhat inconvenient things that you can definitely do, and we know we're going to help.
Yeah, no, that is a great point. Question from Mary, who wants to know, does social distancing extend to siblings, kids playing together?
Well, I got 5 kids, so at my house it does not. We let our family play together, our kids play together. My wife and I are together. We are trying to avoid everyone else. My in-laws actually live very close to us, and just today we were talking about trying to distance that more. It's something we've been grappling with because it's such a way of life in our family for the kids to see grandma and grandpa. But I think we're going to probably change that. But I would not have a problem with siblings. Now, I think several of my kids have had phone calls from friends wanting to maybe get together, and we are not doing that. And those calls seem to have dropped off too.
Yeah, it seemed like in the beginning not everybody was on board with that, but as parents, let's support each other on the no sleepovers policy till further notice. We're going to take a pause here for the news. We're awaiting the announcement from the city and the county, and as we're able to next hour, we're going to resume with Dr. Haverkorn, get as many questions answered as we can. So all of it continues live on 550 and 107.1 KTSA.
Hey, coronavirus, the latest information and what you need to know. KTSA.com/coronavirus.
6:21 is our KTSA news time. Jack Riccardi, very busy Monday late afternoon. We just had the news conference with the mayor and the county judge, and we are reaching out to Judge Wolf. We may get him on here at some point to ask a few questions about the shelter-in-place orders jointly issued by the city and the county. And in the meantime, a lot of questions for our doctor, Dr. Mark Haverkorn, with us on our KTSA Connecticut Quality Water Softener Newsmaker line. If you want to ask him a question about prevention or best practices, protecting yourself questions about coronavirus. He's agreed to stay a little later with us and do that, and you can do it at 210-599-5555 or email me. I'm getting a ton of email questions. Jack@ktsa.com is the email. Dr. Haverkorn, Fidel wants to know, is there any research into the corona vaccine for dogs, and could that possibly have effectiveness or be modified for humans?
I have not specifically looked at that question, so I actually don't know. I do know that the vaccines that we're trying to develop now are sort of modeled off of what we discovered with SARS and MERS, with these things all being coronavirus. So when you make a vaccine, you've got to find a part of the virus that really triggers your immune system the most. If you get a part that only weakly triggers your immune system, it's not going to be effective. But fortunately, with our past experience with coronaviruses, we have seen, at least in humans, which part of the virus triggers the immune system the strongest, and then we can use that, to create a vaccine. And so my understanding is that's what they're doing now with this new COVID-19 virus. So I don't know if what works in dogs would work in people. I don't know enough about the immune system of a dog to comment.
Right. Well, I know that we've, in the beginning, everybody was sort of threatened or challenged by the uniqueness of this particular virus, and yet as time goes on, it seems like researchers are starting to find pieces of it that remind them of or bear resemblance to other things. And I've heard scientists say, for example, there's a little bit of the behavior we saw in SARS, and there's a little bit of the behavior we saw in HIV. So I guess as time goes on, one of the things that's happening is, the investigators, if you will, are starting to find things that do look familiar in what is otherwise a very unfamiliar event, right?
Yes, absolutely. I just wanted to mention, and during the break I looked, and coronavirus, I saw a New England Journal of Medicine article that says it can survive about 3 hours in the air after being coughed out. So I know I can't find anything about the hands. I'm still trying to find that.
Yeah. Well, I guess that would be a variable too how long it lived on your hands would probably have to do with what you did with your hands during that time.
Right.
What you touched and all of that. Let's see. Josh on line number 1 with a question for Dr. Mark Haverkorn on KTSA. Hi, Josh.
Hello, Dr. Haverkorn. I had a question about if you're out getting groceries, what can you use since there's no hand sanitizer? Would hydrogen peroxide be okay to disinfect your hands, maybe the shopping cart, or a grain alcohol like Old Charter or Everclear maybe?
Well, that's a good question. And yes, the answer is yes, that those things can work. Now, we did see that Tito's Vodka made a point that they don't have enough alcohol to be able to do that. You got to be over that you got to be over that 62% alcohol. So you would need that. You can also use 0.5% hydrogen peroxide or a 0.1% bleach solution. And the CDC has info on their website about how to take care of your house, on how to mix up that bleach solution if you want to. Right now, it's a little hard to find the peroxide.
Right. Josh, good question. Thank you for that. 210-599-5555 on email from June. Doctor, is there any anecdotal evidence or any degree of protection if people have had the latest pneumonia vaccine?
I don't think that there's a cross-reactivity and protection there, although having the pneumonia vaccine is going to help prevent secondary infections if you were to get the COVID-19 infection. And we do know that some people are dying from secondary infection.
So for some people, it turns into pneumonia, right?
Well, it is a viral pneumonia. I mean, the severe cases where people end up in the ICU, that's a viral pneumonia. It's a viral lung infection. And sometimes that alone is enough, and then it can also move to the heart, and people get inflammation of the heart muscle, which obviously isn't good. But if they get a secondary bacterial pneumonia on top of the viral pneumonia, that's even worse. And the pneumonia vaccine, the pneumococcal vaccine, could help with that.
We're hearing a lot of talk. Dr. Birx talked about it at the briefing today. We're hearing a lot of talk over the weekend, too, about the development of a home test kit where people could swab themselves, just as nowadays people are able to do home testing for colorectal screening, things like that. You'd bring your sample to a lab or drop it off, and it would prevent people from having to go in and line up, and the extra exposure to healthcare workers or lab workers. As a doctor, Dr. Haverkorn, how confident are you in that being as good as a lab-administered test for COVID-19?
Well, I think it's really about how good is the sample that you get. And so if a person at home is able to do a good swab, preferentially in the back of your nose, which is a little uncomfortable. I've actually had it done when some of my friends in residency wanted to experiment. So you can stick a long Q-tip all the way in the back of your nose and rub the back of your throat. And if you could do that at home on yourself, that would be better. If you swab the back of your mouth way back there, it's a little less accurate. The most accurate tests are when we actually wash your lungs and take a sample that way. Obviously, no one can do that at home. But I think if we can get some tests out there, I think that would be helpful. I think sorting out who has it, who doesn't have it would be helpful. What I really am curious about is what are the false positive and false negative rates on those tests. And I've tried to find that information, Jack, and I just can't find it.
Yeah, I mean, I know this is all a work in progress, and I know a lot of these questions require you to do a little more speculating than you probably want to do, but your speculation is better than ours, and we appreciate that. We're going to step aside here. We're going to have more time with Dr. Haverkorn. We may hear from Judge Wolf. You're going to get the latest here from Dennis in the KTSA 24-hour newsroom. If 638 on 550 and 107.1 KTSA, the city and the county have issued their shelter-in-place orders that go into effect tomorrow night at midnight and continue till April 9th at midnight. And we may hear from the county judge at some point here. We just have to wait and see. This is kind of a work in progress. But we are going to spend a few more minutes with Dr. Mark Haverkorn, who is a medical doctor and a board-certified oral surgeon and well-versed in a lot of different things that come into play when you're trying to not get coronavirus or understand it. And so we've been taking your calls for him at 210-599-5555 and also questions via email, if you have one, for him. This is a question, Doctor, about, because we were just talking a minute ago about the testing. Elaine wants to know if you think they will require COVID-19 testing or temperature taking when kids go back to school. I know that's a prognostication question, but what would be your thought about whether that would be necessary or effective?
In the midst of the outbreak, I think it's necessary and effective for sure. My kids, my youngest kids are in daycare. One of them, well, in all honesty, they're not in there right now, but one's enrolled, one's part-time. And I know that at that particular daycare center, if the kids are still there, they're taking temperatures, when you come in and during the day. And so that's definitely a good screening technique. Obviously it's not 100% accurate, but that's a good screening technique. If we open schools up right now, I think you'd have to do that and probably consider testing. If we get on the back side of this curve that everybody's talking about, where things seem to normalize, then that may not be as necessary. I guess the real question, the real hot topic would be, are they going to require the vaccine when that's available?
Yeah, I've heard people say that too. And I guess these are things we'll have to worry about another day because they're off in the future. They're not going to open the schools anytime soon from what it looks like. 210-599-5555. We'll go to line number 1. And Wib with a question for Dr. Haverkorn. Go ahead.
Hi. I believe this might have gone out the window once emergency disaster or emergency situation was declared. However, how are the HIPAA privacy rules affecting the efficacy of what's going on, like in tracking who's contracted from who has it, and all of that rigmarole?
Yeah, well, I know that, there are exceptions to HIPAA.
Okay, so your doctors can exchange information with insurance companies if you want to use insurance and that kind of stuff. And I want to say, I didn't read up on this, but I want to say that emergency, governmental actions like this are exempt. I think it would be possible to preserve the patient's privacy, though, and just to say, we know that someone you were in contact with tested positive, and we'd like to know who you've been in contact with.
Yeah, that's a whole big area, right? Because not only would the government, quote unquote, have an interest, but employers are having to figure out how to find out what's going on with their employees in a climate where normally you couldn't ask any question. You're not allowed to even go near any of those questions, right?
Well, Jack, I read about your question about South Korea during the break, and I mean, the answer to how they got better was largely just getting rid of privacy and allowing a lot of government intrusion into people's lives. And I mean, that's just something as a society we would have to come to grips with.
Yeah, and that's why it's probably safe to say you can't really, take in a whole sense or in toto what they did in another country and apply it here. The laws are different, the culture's different. We have the Constitution, yes. So we can maybe borrow some bits and pieces that are good practices. But South Korea is very interesting in that it has a very big population. It's a very advanced country, and yet has had a relatively light experience with the spread and the death toll from COVID-19. Let's get to Harry on line number 2 on KTSA with a question for Dr. Mark Haverkorn. Harry, go ahead.
Good evening. Say, man, me and the wife both, I guess it was somewhere around mid-January, had a flu bout with, fever, chills, a lot of the COVID symptoms, but aches and pains and all that general flu stuff, and we got over that, and everybody's okay right now. Would that help us, our immune system, if we did come in contact with the real coronavirus?
So influenza and COVID-19 are totally different types of viruses. Flu is influenza, COVID-19 is a coronavirus. I'm not sure, but I feel pretty confident in saying that there's probably not a lot of cross-reactivity there, and I really don't think immunization or developing immunity like you might have to the flu would transfer to a coronavirus, including COVID-19. So I wish I had better news for you.
All right, Harry, thank you for that question. 210-599-5555 or email jack@ktsa.com as we are spending our last couple of minutes here with Dr. Haverkorn. So as you understood that order that we had from the county and the city, Doctor, what does that mean for your practice?
Well, it's not going to shut down my practice. I mean, we're a medical practice, and dental practices are included too. What's more important? You were already, though, not doing elective things, right? So Governor Abbott's order yesterday pertains to my practice more than that does. Right. And his order was to not do elective stuff. Although I will say that today the Texas Dental Board and the Texas Dental Association both came out and said, hey, we want to clarify, Governor Abbott wants to keep dental patients out of the ER. So you guys do that, but nothing else, Is this more, so part of it is to alleviate the load on the ER. Isn't also part of this so that you're not consuming as many of the so-called PPEs, the things that other medical professionals will have a greater need for? Yes, absolutely. We're trying to preserve that. I'm already on limited allocation from my suppliers, as is everybody. And so, if I use less of it, then there's more for the hospitals. If some of the general dentist offices choose to completely close and there's, less of, or they use less, that's good for the hospital.
Yeah. So that's another big part of this challenge. We're all trying not to get sick, but we got to keep the supplies up too.
Yeah, well, Jack, and if somebody goes to the ER, there's the burden on them, but also if the ER does have 3 or 4 active corona patients there and you're going in for a dental problem, not only is that a burden on the ER, but also you're exposing yourself.
Yeah. I'm a germaphobe. You don't have to tell me. I would have to have a piece of me fall off before I would go to an ER right now. I can tell you that.
Well, I'll have
Doctor,
to share
you're
my.
wonderful. I hope that you will come back with us again soon. We would love to do this again. And thank you so much for everything you do with your practice, River City Oral Surgery. And thanks for taking all these questions tonight.
Yeah, thank you so much for the opportunity. Be well.
You too. We'll talk to you soon, you and your family. We have KTSA time, traffic 646 on a Monday night on KTSA.